Did you hear me just now? Okay. All right, good morning, everyone. Our sound check has worked this morning, and I'm looking forward to bringing this message to you today. Avoiding lower back pain and avoiding lower back injuries is a very important part of life and getting through your life without limitations. We want to live as long and as healthy as we can. And lower back pain is a very debilitating problem. And we're going to go into some of the details of it. We have about 15 minutes on the instructional part, and then we'll be able to open up for about 10 minutes of questions and answers if you would like to participate in that. So first of all, how common is lower back pain? Well, a lot of people get it. Half of all working Americans admit to having some lower back symptoms each year. And with most people, they'll feel some pain, they'll take an Advil or a Motrin, and in a couple of days it goes away, and they say, oh, I used to have it, but I don't have it anymore. That's like someone saying who has high blood pressure that they used to have high blood pressure, but now that they take medication, they don't have it anymore. And that's kind of screwy logic because it's just being covered up. So a lot of Americans have it, and even if they don't have back pain, they could be having weaknesses in their lower back that limits their ability to get around. And when you look at the impact to the workforce, it's incredible how many millions of days are lost because people are having just back issues. And worldwide, we look at the fact that the years lived with disability has increased by 50% in just 25 years. And there's a statistic that everyone knows called life expectancy, but there's another statistic called health expectancy. And health expectancy is the amount of years that you will live in disability or illness in your life. And with the average American living to be 80 years old now, people are only living healthy till about 68. So that means the average American is spending 12 years of their life in either limited abilities, disabilities, or illnesses. And lower back pain is a big part of that. And the economic impact to the economy is huge. And you'd think that more companies would be teaching their employees better back practices. But in reality, with everybody sitting home now working on their computers, back injuries are going up at a crazy rate. And if we look at the nervous system and the nerve chart here, a lot of people don't realize that the same nerves that are causing you to have back pain are also the nerves that are controlling your organs, your reproductive organs, your colon, your bladder, the power that goes into your legs, your prostate gland, sciatic nerve, ankles, feet, and toes. So when we look at injuries to the lumbar spine, the lower back, this lumbar plexus, which is the amalgamation of nerves that comes out of your lower back and forms into a plexus and then feeds all of the other organs, you could be having digestive issues or bladder issues or reproductive issues because of the subluxations causing pressure on the nerves in your lower back and not even know it's coming from that. Because when you go to the doctor and you say, I have some digestive issues, they're going to do a lower GI or an upper GI, and it's going to result in you taking medication. Well, what if that digestive issue was coming from pressure on the nerves from your lower back? If you don't see a chiropractor and have that checked out, you could be taking medication unnecessarily. And we know medication doesn't fix anything, it just covers it up. So we'd be covering up a problem and allowing it to continue to grow without our knowledge. And that's not a good place to be in. And what we find when we have dysfunction in the lower back, this is a 2-hour topic at least, and we're trying to cram this into 15 minutes, but your spinal discs are very reliant upon your spinal movement. Without spinal movement, those spinal discs start to dry out. But just like rubber gaskets, they dry out. And when they dry out, they start to become arthritic. So if you don't have good motion in the vertebrae of your lower back, your discs are going to dry out, your nerves are going to get pressure on them, and slowly your spine is going to deteriorate. And the average new patient that comes to us with lower back pain is in their 50s, and we already find that they have multiple levels of arthritic changes and degenerative changes in their spine. We should be checking these things when people are kids and when they're teenagers and when they're in their 20s. But so often people think, no pain, no problem. So it just goes on and it becomes a bigger problem as they get older. And there's really no reason for that. It can easily be checked with an exam and an x-ray by a qualified chiropractor. So what are some of the symptoms that you get from lower back pain? Well, you could just get plain old back pain. You can get shooting pain. You can get numbness and tingling in your feet, because remember, those nerves that come out of your lower back go into your legs and your knees and your ankles and your feet. You can have pain that travels through your buttocks. You can have weakness or loss of feeling in the bottoms of your feet. You could have what's known as paresthesias. You could have neuropathy. All of these things are products of long-term pressure of the nerves in the lower back. And don't forget that 10% pressure on a spinal nerve, 10% pressure, which is about the weight of a dime, reduces the nerve flow by 10%. 20% pressure reduces the nerve flow by 20%. But pain doesn't show up until you've reduced the nerve supply by 60%. So you could be walking around with 20, 30, 40, 50% pressure on your spinal nerves and then no pain. One day the pain shows up and you say, my back pain started last week. So that's when my problem started. And in many cases, it had started long before that. The pain can be worse after sitting for a long time. And we're going to look at the compression of the lower back on another slide that will explain why that is. The pain sometimes goes away when you change positions. You get up and you move around. And sometimes the pain is worse when you first get up in the morning. And there's a lot of different types of symptoms, but they're all just symptoms. They're not diagnostic for what type of back problem that you might have. And that's why you need to be examined and analyzed by a chiropractor. So when we look at the pressure on the spine, remember those spinal discs, I said they're like rubber gaskets. Well, they're really hydraulic gaskets, meaning that there's a liquid center that's contained by a ligament, and that liquid center is being compressed by that outer ring, which gives you the hydraulic pressure to be able to stand up. And a healthy spinal disc can handle 1,200 pounds per square inch. 1,200 pounds. That's more pressure than you could supply in anything that you do. So a healthy disc cannot be injured. But when you're doing repetitive things that are slowly wearing that strength of that disc down by doing repetitive compressive actions, then the disc can get weaker down to 1,000 pounds of support, or 800 pounds or 600 pounds. And usually when someone herniates a disc, it's the disc has weakened down below 600 pounds of pressure of availability, and then they can do something that tears it. So if you lie down face up, you're only putting about 25 pounds per square inch on a disc, which is nothing. That's how your discs heal when you lay down at night. Sleeping on your stomach doubles that pressure, so we don't want to do that. Sitting in an office chair with good support is around 200 pounds per square inch, or sitting in a soft chair or a couch, 250, 300, 350 PSI. Bending over from the waist without bending your knees could be 400 pounds plus the weight of the object that you're picking up. And bending and twisting doubles the pressure on your disc. And here's why. The spinal discs have fibers in them that are crisscrossed. And when you turn one way, it tightens one set of fibers and it softens the other. And when you turn the other way, it does the opposite. So you're only using 50% of the fibers in your disc when you're rotating. That's why it's so important to work on your core muscles. That's the ones that give you strength with rotation so that you're not hurting your disc. So we want to make sure that we're not bending, twisting, and lifting all at the same time. That's the most common maneuver where people herniate a disc. And then a hard sneeze. Oh my gosh, you can put 600 pounds of pressure on a disc. I have seen many patients over the years who have herniated a spinal disc from sneezing, especially if they bend over and twist when they sneeze at the same time. Oh my gosh, it's a terrible scenario. So here in our office, we employ the top technique for decompressing someone's lower back. When people come to us with lower back problems, there's typically compression. We use this Cox Flexion-Distraction method, something that I was trained on in chiropractic school in the 70s and have taken many, many seminars and have taught seminars on this over the years. This is the most effective way to help decompress the lower back. Unlike those big machines, they're called decompression machines. Those are very general, they're not specific. This technique is very specific because we're putting our hand right on that vertebrae above where the disc is being compressed, and we're pushing and opening up that space. It's good for disc degeneration, which is very common, herniated spinal disc, sciatica. It is the technique for handling disc injuries. And then, of course, we want to make sure that we're taking good supplements. And there are several supplements that help put the nutrients in your body that your discs use, your spinal discs use to repair themselves. Number one, though, is water. Everything is about water. Your body is made up of mostly water. And if you don't have enough water in your system, your discs are going to dry out all by themselves. Vitamin D is another big supplement to be taking. Vitamin D is very good for your spinal discs. Fish oil. Well, remember I said there was a liquid in the center of that disc? Well, that liquid has oils in it and has omega-3 oils. And those oils are in fish oil. So if you aren't taking fish oil, a good quality fish oil, it's like running your car with the same motor oil in it for 20 years or 30 years or 40 years. It breaks down over time and doesn't have the properties for good lubrication. Bone Fortify is a collection of minerals, because minerals are also very important in connective tissue, because your disc is made of connective tissue. Connective tissue is skin, ligament, muscle, tendon, bone. So the discs are a part of that. Glucosamine sulfate is one of the best building blocks for joint repair. And taking some of these supplements on a daily basis, in addition to seeing your chiropractor for maintenance chiropractic care, is how you take care of that spine on a long-term basis. Collagen is for people who have degenerative discs. So the collagen is a much deeper nutrient value than the glucosamine sulfate. And then the chondroflex is for people who have been taking over-the-counter pain medication for years for their back. So if we look at the Motrins, the Advils, the Tylenols, the aspirin, the Aleve, those are called NSAIDs, which stands for non-steroidal anti-inflammatory drugs. And NSAIDs interfere with the conversion of glucosamine to chondroitin sulfate in your body. And it's chondroitin sulfate that's the most important part. And homemade chondroitin sulfate is the best, the stuff your body makes. But if you've been taking those medications, your body's not making it. So you have to add it back in, and that's where the chondroflex comes in. So all of these things are pieces. And again, this is a very complex subject. We've tried to create a small soundbite to help bring your knowledge level up. And we're going to open it up for questions here in just a minute. But first of all, if you like this presentation and you think that this is something that is of value, if you wouldn't mind scanning the QR code right there, and on your phone, open up your camera, scan the QR code, and that takes you right to our review page. And we would appreciate your thoughts and words if you think this was of a good experience for you going forward. So now we've been through our 15 minutes of presentation, and we're going to open the floor for questions. And I'm going to find the Q&A button, and anybody who wants to answer a question just has to, I believe, type it in or hit. Sarah, will you write in here what they need to do to ask a question? And while Sarah's working on that, there's a few other things that I can add. The Cox Flexion-Distraction method that we use is not an exclusive lower back treatment, because there are other types of adjustments that we use. But if people have degenerative discs or herniated discs, they can't handle rotation of their lower back because of how much pressure it creates. So we don't do the side adjusting for people like that. But the side adjusting is very good for people who don't have disc injuries, and it's a good maintenance type of chiropractic adjustment. And and it's part of an overall analysis of the human spine, and a chiropractic analysis where we can look at all the levels, all 24 levels of vertebrae, and look and see where the issues are. Well, I'm not seeing any questions pop up. I'm going to go ahead and end the webinar now. Our next webinar will be scheduled in September. We will send out a notice on what the topic is going to be, and we're going to try to do these once per month, a 15-minute webinar presentation. And the great news is on the next one, my braces will be off, and so I'll be able to talk like a normal person once again, and it'll make it a little bit easier for all of you to listen to. So we're going to end the program here. Hope you all have a great day.